Okay. I'm seeing some comments. So, okay, let me see if they've been able to join. Okay. Are they still waiting? I'm seeing messages on the YouTube channel.
Okay, now we are on now. Yeah, we're on now. Yeah.
Okay. Okay, awesome.
People are coming in now.
Okay, I'm adding you back to the stream. Okay, that's good. Okay, I'm adding you back to the stream. Okay. Okay, that's good. Awesome. So we have officially started out. Wow. It's really amazing to be here. I prayed for this day to come and this day has eventually come. Wow. Okay, so I think I need to do something before we start. I'm hearing my voice, so I need to effect something. Just a minute, please. Um, okay, can we hear me?
Yes.
Can we hear me? Okay.
I can hear you.
And you can see me clearly, right?
Yes, I can see you and I can hear you.
Oh, this.
I think they are
There's an
already
echo.
in.
Sorry, I'm trying to remove that echo.
Okay. I think they are hearing you. I don't think it's echoing again.
Really?
You're not echoing to
Okay.
me.
I'm I'm echoing to myself. Okay, let's see how it goes. There's a guest. Let me bring on another guest. Okay. All right. So we are starting out now. Welcome on board, everyone, to the Send Awareness Program. I'm really excited to have every one of us here. I prayed for this day to come, and this day has eventually come. I am Adeswa Omi, the stepped up nurse, and I don't know. Well, at the end of this program, my job and introduction. It's possible that you've met me, it's possible you haven't met me, but we are going to start right away. And before I bring on our guest speaker and the reason why this program was put together to meet with our mothers and have an experiential sharing about this special care, special needs people, I'm going to give a short introduction about this program, right? And I believe that everyone on this call right now listening to me are all nurses. So if you are a nurse, it's imperative that you please stay till the end of this program. And when I mean nurses, I also mean student nurses. In the nursing profession, both nurses, registered nurses and student nurses care for patients. We meet patients, we meet people in the community, we need people in the society every day, and we have the opportunity to give care to people. So I'm going to be talking within 15 minutes. I should be done by God's grace, and then hand over to my oga at the top. Okay, so let me start, right? I will talk briefly on the importance of the role of nurses in caring and advocating for the vulnerable in the society. Now, when I first of all met Mr. Ehi, I was like, okay, what is this about? Yes, I know what autism means. I know what dementia means. I know what special needs mean. But actually, as a nurse, I don't know how to help those people. I cannot confidently say I know what to do. We could all say it's because I'm not it's not my specialty, but in Nigeria I don't even think there is a specialty that deals with that. I know we have pediatric nurses, we have psychiatric nurses, but I don't think there is actually a full focus on these people. So I want to talk briefly on what are our roles as nurses. If these people come to us, if people with special needs come to us, what will we do to make life better for them? That's basically what I'm going to be talking about, advocating for them and making life better for them in this society, because they are everywhere. Now, this set of people are people that people would rather not talk about. Some parents would rather shove them to the background. Some parents would rather send them to the village. Some parents would even try to destroy these children. Yeah, we have different variants of human beings, and because they didn't get what they want the easy way out. They just want to get rid of any form of challenge that they have. Now, we also have awesome parents that want to see that these children do well no matter what. We have lovely, powerful parents that are ready to stay true. But what are we nurses going to do to really make life easier for those people? Because if you look at the definition of nursing, right? At the end, we get alleviating suffering. We are supposed to alleviate people's suffering. We are supposed to make life easier for people. There are some people that we cannot particularly cure them. There are some people that we can't particularly give a and be totally long lasting, right? We cannot say, oh, this is the end of your malaria. You are totally free of malaria and you can just be free of the symptoms. There are conditions in which you have to deal with these things. You need to just deal with these things, and it might be for the rest of your life. When my mother had hypertension so many years back, she had to come to the realization that I need to deal with this thing no matter what. There is no escaping taking my medications. There's no escaping the lifestyle modifications that come with hypertension. Now, there are lifestyle modifications that come with caring for people with special needs. For hypertension, you can say, oh, don't take salt, oh, reduce oil in your diet, oh, do this, oh, do that, right? Some things are easier, and then some things are actually tougher. Can we nurses make it easier for them? I'll be talking on 4 or 5 points, right, this evening, right, that can make life easier for these people, because we need to realize that they need us, right? The practice provides vital insights into the existing challenges and the potential opportunity in this area, and it is with the major aim of strengthening the capacity of the profession to respond to the needs of these vulnerable children or these vulnerable young people, right? So nurses and midwives play an important role in prevention, right? Prevention, and then in early intervention strategies, right? Because these strategies are what really makes life easier for these people. And the first thing I'm going to talk about is education. One of the biggest pillar, in this, that's why nursing profession can never be done away with, because even if you bring robots, there are some things robots may not be able to provide empathy, right? There are some things that robots may not be able to do, because humans will always be humans. There are certain reactions that you get from human beings, right? Now, we need to educate people. We need to educate these mothers. We need to educate these parents, the carers, the primary carers of these people. We need to let them know that, oh, this is how to do this. But you cannot educate someone when you don't even know what to say. If you are not enlightened about these things, if we are not here on this program, that's what I told Mr. Eric that, okay, yes, we need this. We need this. This is not vital science. This is not blood pressure. This is not general knowledge. We actually need to get on this. That is my major reason for encouraging people, putting out on social media, on LinkedIn, on Facebook, everywhere, and encouraging people to join. And despite all this, a lot of people are still looking like, what's my business with special needs? I hope we will not
Mm-hmm.
need to be the primary carers of these people to to remember that, oh, I saw something like this and I didn't pay attention. Because even if you are not a primary carer, these people would eventually meet with you at one stage of their life or the other. So if you don't get educated about these things, you wouldn't know how to help them, and you wouldn't even know how to carry out your own job as a nurse to help, to truly help these people, right? So education is very important. And what are the things that you educate them on? The symptoms, treatment modalities, treatment options that they have, and then the potential outcomes that may come out of all of this. Then the available support resources, because these families need support. These children or young adults need support. The people caring for them need support. There's something we say in nursing that patient relatives are sicker than the patients themselves. Because it's actually true. If you're taking care of someone that is not just malaria, it's not, we are not talking about typhoid, we're not talking about something 3 days, 1 week, you're done. When you're talking about a terminal condition, a condition that will stay, that will just be there, then the people caring for these people need support. They need understanding. They need love. They need, as in, I don't know what the Nigerian government is doing regarding this. I've written a paper on disability before. That was in the month of May or June. When I wrote that paper and submitted it, I had have a deep discussion with my husband. I was like, what is the government doing about, as in, when I got those articles, I was like, this is crazy. So these people are suffering so much. Like, somebody was trying to talk about how she gets to get money out of her ATM and how she gets robbed, how some people will try to use ATM for her and still collect her money. Like, you want to help somebody to use ATM and you still collect money from that person and you expect that you will break forth in your life. I don't get it. And somebody tried to talk about going to the bank, and when she gets to the elevator, the person, the security, we have to tell him to get down from his wheelchair and roll over on the floor into the banking hall. And then when he rolls into the banking hall, the person cannot even maintain eye contact with the banker because the person is up there, sitting up there and trying to form I'm a boss. And the person that wants to be attended to is on the ground. There's a long line. It's crazy. They get so demoralized. They feel like your world is against them. If you study and read about disability, you will know that every breathing day of your life you should be thanking God, right? So that's all about education. I'm going to talk about screening. Now, when these people come to you as a nurse, even as a general nurse, there are some things that you should be able to notice, right? That will help you to see, okay, this person has autistic features. Let me help this person to go to the right channel, to get the right specialists. We can talk about pediatric neurologists, we can talk about speech therapists. If you cannot note those people at the beginning, it might be difficult for you to help them on time. Definitely, somebody may eventually help them, but why isn't it you that they will meet and they'll be able to get access to help, right? Now we talk about personal care. Personal care is very important because every day self-care, hygiene, safety, these are things that their primary carers need to know. And if you as a health professional cannot even help with these things, like for instance, a woman just discovered that her child is autistic when the child was a year old or 9 months old or 2 years old, and she comes to you, and what you have to say is not even correlating. Like, you are just saying, okay, just hello, sorry, okay, go and pray, or just, you just do something that's not even following. Everything is not gathering in the middle. You just give an advice like an everyday person. That means your professionalism has not come to play in what we are talking about here. What? Miss Aisha is just laughing. Your professionalism has not come to play here because you are not knowledgeable about what's going on. So that's why every opportunity you get to actually add knowledge to yourself, please don't run away from it, because you don't know who will need your help at that time. So these people need encouragement. They need to be able to boost their zeal. They need positive reinforcement every time. So if it is you that they make meet, please do everything to reduce their anxiety, do everything to connect them to a specialist to help them. Now, another thing, another way you can help them is regarding arranging healthcare visits, because in the society, some of them are out there, you know, they don't even really know how to get access to help. So if you can connect with them in the society, okay, you can bring them in, you can be that link. It's just to link them. It's not as if you are the one that will do everything. It's not like it's you that want to solve all their problems. But see, that's linking them to opportunities or linking them to solutions is a very vital part of their care. Very, very vital, because information is actually life. I tell people that, okay, if I'm here giving you information, telling you that this is the right place to go to, I tell people that if you have breast cancer, if you have a lump, don't just go to any private hospital, because they can compound your problem. You don't even know where that person graduated from. Go to a specialist. If you go to a specialist, if the person carries out breast self-examination, I ask you to go for a mammogram. The deductions the specialist will make will be different from what Mr. Ehi will say about an autistic child. Is totally different from what I would say. So if you came to me, what would I have told you? So what I would just tell you is, oh, I have Mr. Ehi's number, right? I will give you his phone number. Please try and call him today. When you call him, please give me feedback and let me know that you have called him. You have created the link. You have created that link, and the person, come, thank you, I've got the nurse, and the person even gave me, the person even said many. A lot of people come to me, I'll tell them I'm a pregnancy coach, I'm not a fertility nurse. There is a difference. They'll say, no, I know you will help me with my conception. See, come, I am not a conception, I am not a fertility nurse. Link people to the true solutions that they need. That is what we need to do with, these people need a lot of care visitations. They need to come to the hospital a lot. So link them to the right set of specialists that's going to help them. I'm going to talk about advocacy. I think I've used 15 minutes already. Advocacy is very important, and it's just like what I've said before. These people have values, these people have their own beliefs, they have rights, and these rights cannot be trampled upon just because they have autism. Their rights cannot be trampled upon just because they have dementia. Let's try and advocate for these people. This is part of our roles as nurses. I have 21 people on the call. Please, if you're on the call, please drop your name and let's know where you're joining. Your full name, please, and let's know where you are joining us from, right? Okay, I'm going to talk about case management. I'm just going to try and wrap it up from there, right? A nurse needs to be familiar with the techniques, especially regarding communication, because some of us don't even know how to communicate with. Even me, if I see an autistic patient, I don't even know how I'm going to communicate to that person. I may first of all be lost, right? So case management is very important. We need to actually improve in that area. These strategies, they have communication strategies that's going to help them. Now, if they have strategies they've used in the past that really worked for them, and they could comply with those strategies, it's good enough to utilize them again and again to help them, right? Also, let's make sure that they get access to the needed resources, right? Thank you so much. I believe that I've been able to add a little to your knowledge regarding the roles of nurses for people with special needs. Thank you so much. So I'm going to now bring up our next our guest, right, is going to talk not a little more. He's going to talk for the rest of the evening. And probably Miss Aisha will also give us an experiential sharing, right, on people with special needs. So I'm going to read this introduction now. This introduction is a textbook, but I'll try and summarize. I'll try and summarize as much as possible. So I'm supposed to dress in a special manner to do this introduction. Like, I'm supposed to. Miss Aisha is looking at me. This woman is not. Okay, so now, Mr. I hope I'm pronouncing your name properly. Mr. Ehi Agbeyi is a registered nurse. That's one thing I want you to go home with, right? It's not easy to know all these things about special needs and still be a registered nurse. See, I don't think anybody on this call will share the same bio as Mr. A. So that's something you need to respect. When you see extra knowledge, you need to respect extra, like that's addition that you don't have in your on your CV, that you don't have in your head, is something we need to respect in other people when you meet specialists, right? Now, he's a registered nurse with a BSc also in adult nursing. He's a lead support consultant at East Neurocare and Diversity Support, the NGO that organized this program, right? He's also a teacher and a special care practitioner and a care leader. He has worked at Harps College as a life skill advisor, an autism trainer, and a team leader for people living with autism and co-occurring syndromes. I believe, okay, I want to be sure that everybody, okay, thank you, but Oga Popola, it's good to have you on the call. So he has worked at the Alps College as a life skill advisor, autism trainer, and a team leader for people living with autism, co-occurring syndrome, learning disabilities, and mental health issues for 6 solid years. He has also worked with the Autism West Midlands at the Coddington Court School, developing independent living curriculum and providing social and life support to teenagers. He has worked as a teacher and a pastoral carer for students at Redeemed Christian Church of God Missionary School. He has worked for 10 years at the West Midland um, Learning Campus as a care practitioner with people with various neurodiverse conditions. He's the chief executive officer at Adrak Healthcare Limited, Lagos, Nigeria, a company that is disability service based. He has worked with the National Health Service (NHS) England for 4 years, nursing patients in the medical wards. Like I said earlier, is a lead support consultant at East Neurocare, a charitable association providing interventional support and guidance for family carers of those living with neurodiverse needs. He has an MSc in education, a BSc in adult nursing, a PGD in education, a diploma in autism, in neuro-linguistic programming, and a diploma in health and social care. Join me to welcome on board Mr. Hey Agbeyi. I'm not saying Mr. I'll say Nurse A Agbeyi. It's good to have you. Thank you so much, sir. You have the floor now.
Thank
Thank
you very
you.
much, Adesua. Can everybody hear me?
Yes,
Aisha,
sir.
can you hear me?
Yes, sir.
Adesua, can you hear me?
Yes, I can.
And so I believe everybody can hear me. I would, Adesua has introduced me. I wouldn't want to. My name is Eri Agbeyi, and that's all you need to know. We're going to be looking at autism, and attached to autism today, we're going to be looking at learning disability co-occurring syndromes. They are all one and the same thing, but they are all attached to each other. So autism does not just exist in a vacuum. It has what nurses will call comorbidities, or probably what we refer to as co-occurring syndromes. However, before I talk about what autism is, I have worked for over 2 years in the Nigerian space. I've worked with families. I've worked with people with autism and co-occurring syndromes. And there was one thing that stood out. What stood out is people do not have a good grip of what these things are all about. Some people think when you're autistic, you have a mental health condition. Some people think when you're autistic, you can't amount to anything. Some people think when you're autistic, you can't achieve anything. You are just so disabled that you need support all the rest of your life. And without that support, you are finished. Before I call Aisha to tell us about our experience within 5-10 minutes, before I go into the full training, I want you to know that autism cuts across all spheres. I want you to know that the richest man in the world today has Asperger's syndrome, which is part of the autism spectrum. I want you to know that people like Keanu Reeves, they border on the line with autism. And so many other celebrities that you probably have heard of or you don't know about that are on the spectrum. So don't see autism as all gloomy and doom, but there is so much strength within autism, and that's where you as a nurse or as a parent want to tap into. And before we go into that, I want to call on Aisha, wonderful lady. She's a family carer, and I've worked with her for close to a year now, and it's been very wonderful. She has a lovely son, very brilliant boy, academically sound, but he's on the autism spectrum. She's going to tell us some of her experiences. In 5-10 minutes, just share with the house your own experience of what autism is and let them have a feel of what it means to care for somebody with autism. Over to you, Aisha.
Good evening. Good evening, everybody. My name is Aisha. Um, I am a mother of a 3-year-old, soon to be 4-year-old, that has autism and symptoms of ADHD. Well, like Mr. Adesua said, the reason I was laughing when she said people will say go to the mountain and all that. Recently, I went to get my son some sensory toys, and the woman I was buying from said, I know it's not easy what you are going through, but I think you caused it. You were not putting on safety pin when you were pregnant. Someone else has told me that it must be what I ate. A lot of people have said a lot of things to me. They've basically told me that it is my fault, but then they don't understand what it is or what it is like to be with someone like my son. And I'm not sad to say that I've lost friends over the fact that they think that my son is mad or over the fact that they think that my worries are invalid. And when I started working with Mr. Ehi, we were considering putting him in school because many people were accusing me of keeping him at home, and that was the reason why he was not speaking at the time. And when I finally took him to school, they would neglect my son, and he would be lying down on the floor when I come back to pick him, or he would come home with bruises. And then his teacher was trying to convince me for almost one whole term that my son is deaf, until we pulled him out and brought him home. And in less than a month, he was doing better than people in the 3rd class. People don't understand why it is difficult to take. It's not like we don't want to take them out. It's that when you take them out, people see them and people judge them because they don't look a certain way. Because people don't understand that there's a difference between different types of disabilities like cerebral palsy and autism. They expect my son to look a certain way. And so because he doesn't look that way, they expect him to act a certain way. And when he doesn't act like that, they make rude comments. My son can stay up for 4 nights straight. He can sleep in 24 hours, only 3 hours. And it falls on me. And certain people still will say things like, you spoiled him. It is because you allowed this. It is because you allowed that. But they don't know how we live in the house. They don't know that he has to follow routines, and he actually sleeps really early and eats really early. It's just that he can't help it. There are times that he wakes up to pee around 12 p.m. or 12 a.m., sorry, and he will not sleep again till 4 a.m. I don't have a choice. I have to stay up. There are days that I would tell someone, please don't give my son this type of biscuit, or don't give my son milk. He's lactose intolerant. And it's normal for some autistic kids to be lactose intolerant. Please keep him away from certain kinds of food. And they would think that I'm just being overly protective. And it happened yesterday. I went out. My son doesn't take this kind of biscuits. My son doesn't take this kind of. The person still gave him because people just think that I am too. My worries or my comments are just so that they will say, come back that kind of situation. And by evening, he was purging. He wasn't just purging because he would not speak, he would not express his feelings. He was stooling on himself. And then the person came and said, how can a big boy like this be stooling on himself? Whereas I have explained that it's not like he does not talk, he just doesn't express his feelings. So if you are going to give him this, you have to watch for his body language to know that he might want to use the toilet or this or that. So I don't know. I think for for a lot of us in this part of the world, we still need to be educated a lot because even among family members, it is hard to be in certain spaces because they will not understand, and it will still boil down to in mama dey spoil am, or the parents allow him without understanding what it is. And I think it's not like people cannot understand. It's that people don't want to understand because they don't experience it, because they don't live with it. And so there are a lot of examples I can give, but time will not permit. And then I think the bottom line here is we still need to be educated a lot. That's just it for me.
Thank you very much, Aisha. It was nice hearing a first-hand experience of a parent who is caring for our own son that has autism and ADHD. It's also very encouraging when somebody like Aisha, who had a corporate job, had to leave her corporate job to be a stay-home mom, to be a carer for the child. Um, and that's a very noble job to do as a parent. Um, I have worked with parents, and I've worked with parents where the husband and the mother are working tirelessly to ensure that child has the best of care. And I've also seen some other families where the father castigates the mother as the cause of the child having that disability. And it's a shame that some people still think that being on the autism spectrum is as a result of one um, um, mystical thing that happened, or one witchcraft, or one not putting safety pin on your clothes and driving off spirits. In the 22nd in the year 2022, people are still, even you'll be shocked that educated people are still thinking like that. I would want you to know that it's not just only in Nigeria or in Africa that we have that problem. Even in the UK, there are people, when we go out with some of these lads, giving them social support and community support for them to integrate into community. And you will find out that there are even people in developed countries who still are backward, and they think um, just like the way an illiterate African or an educated illiterate African, if I can use that word, would say. So don't think it's peculiar to Africans alone. It's not. And that is why education is very important. It's good we understand what autism is. And from that point of knowledge, or from the perspective of knowledge, we are able to provide adequate support, advocacy, and stand for them. I would not bore you with research and evidence-based practices that we use in autism support, because it will just make the whole process very boring. So I'm going to be very practical in my training, and for you to be able to interact with what I'm saying. Maybe some of you have come across it as you walk on the ward. Maybe you had a patient that probably had some of these symptoms and expressed them. So basically, we will be looking at that. I sent a note, or the HR department of Ease Neurocare sent a training note. So I'm just going to be following the training notes to offer my training. If you have a question, as I speak along, if you have a question, just put it in the comment. Adesua and Esther would help to sieve those questions for us, and I will try all my best to answer those questions as we go on. Day one, we want to look at basically the baselines of these things. We want to look at autism. I know in the outline we gave, we have a parent experience, which we have all seen. We have what is autism spectrum. We have what is learning disability. We have the blue shots. We have dementia. We have disability and disease. I will want to categorize these things into two. I will talk about autism, then I will talk about dementia. In between, I'm going to sandwich learning disability and co-occurring syndrome with autism, because they all kind of work together in an individual, or they don't. So you could see an autistic person who has learning disability and has some other co-occurring syndrome, like Aisha's son has autism and he borders on the ADHD line. And so ADHD becomes a co-occurring syndrome to autism. You see some people who have autism and they have Down syndrome. So Down syndrome becomes a co-occurring syndrome. But we're going to be looking at all these things as we proceed. The first question is, what is autism actually? I will want to give you a definition that autism is a developmental disorder and this and that. We all know it's a developmental disorder. We all know that the cause of autism is unknown. It could be anything. It could be as a result of a lifestyle. It could be as a result of genetics. It could be as a result of environment. But there is no specific cause that they will say this is exactly what causes it. A child is born with it. Some of them are diagnosed early. Some of them are not diagnosed early. Some of them, they don't even show symptoms at a very young age. And probably by the age of 8, 9, you start seeing the symptoms showing. And so you see a child who has been doing so well now starts showing certain symptoms that you now feel, what's going on? I want to reiterate here that being autistic does not mean you are a dullard. Being autistic does not mean you can't function. Being autistic does not mean you can't live independently. I want to set that outrightly, because I have been privileged to work with a lot crossing from the age range of 7 to the age range of 60, 70 years old autistic people. And they are one of the group of people that fascinates me. They fascinate me because of the way they are wired, the way they think, the way they do things, and the way they approach life. They approach life in a very, very simplistic way, and not as complex as many of us who are under the neurotypical setting. When we say neurotypical, what we mean is the generality of the public behaves in a certain way. So, for instance, social ethics, everybody has that connotation of social ethics. And so everybody just understands what social ethics is and how to behave in the public. and things like that. And so we're going to be touching each of these things, and as I proceed, we'll be touching them. So autism, like I said, there are certain things that defines it. There's what we call the triad of impairment. In some circles, they are frowned against that word impairment. The word impairment is used in the professional setting, but some people in the public frowns at it because it connotes a negative impression. So I remember when I was having a discussion with some people, I said, why don't we look at it as the triad of difference? But we still use the triad of impairment because those things that is in that triangle kind of is what defines why autism is what it is. Three things in the triangle is communication, social interaction, and imagination. And so what the triad of impairment actually expresses is the fact that people on the autism spectrum will either have issues with communication, with imagination, and with interaction, social interaction. So I'm going to be looking at communication, imagination, and interaction, and we're going to be looking at kind of examples to kind of explain what it is. So let's look at communication. Communication. A lot of people that I've worked with, families that I've worked with, their understanding of communication with the disability is my child can't talk. And so I want him to talk because we think communication is just speaking. But you will agree with me that communication is a minefield. Communication is not speaking. As nurses, a lot of us get to do tests here and there. And when you're doing an English test, you know that you will have to do a test in English, in speaking, in writing, in listening, in comprehension. And so communication is a minefield. It's not only speaking, it talks about your ability to listen. It talks about your ability to understand, comprehension. It talks about your ability to understand facial expressions. It talks about your ability to understand body language. It talks about your ability to be able to read, to be able to write, to be able to visualize something and identify it. And so even somebody who is deaf and dumb will still be able to communicate through sign language. That's a form of communication in itself. So communication basically is about being able to relate to somebody else. It does not have to be through speaking alone. But in my experience, a lot of families and a lot of people think communication is the child can't talk. I want him to talk. And you could hear Aisha saying some of them felt the child was deaf. A lot of autistic people are not deaf. Deafness is not even, is far away from autism. It's a different thing. And so, but they could be non-verbal. An autistic child could decide not to talk. It could be non-verbal. There could be a reason why he's non-verbal. But in my experience, there are so many of them who are non-verbal, and there are so many of them who are very verbal and very articulate in the way they talk. Very, very articulate. So when we look at communication impairment, we are looking at the fact that is either they are non-verbal, is either that individual child or that individual adult is unable to speak or will choose not to speak. But everything you tell them, they hear it and they probably understand it. And so they would probably not speak because that's the impact of the autism spectrum disorder that they have. And you also find some that are very articulate, but in their articulation, they could also have a communication impairment, which is basically maybe the way they interact. An autistic person would not, if you are fat, they will tell you are fat. They are not going to tell you using social ethics now to say, oh, let's look for the nicest word to use. A clear example of social interaction issues that they put in quotes about autistic people is an autistic person, if you tell him, oh, it's raining cats and dog, they could tell you, where is the cat and where is the dog falling from the sky? And that's social interaction, communication impairment, because they are articulate, they can speak, but they don't have that, they take things very literally. So they don't understand all those your social gimmicks of it's raining cat and dog. It's an adage. We all understand what means raining cat and dog. And raining cat and dog basically is the rain is heavy or it's torrential, isn't it? And if you tell an autistic mind that, except if he has trained himself to understand that adage, if he's not trained himself to understand that adage, he would expect to look outside to see a rain and to see the rain of cats, a literal cat and dog falling from the sky. And so when you're speaking with them, you must speak in language that is clearly understood. So if, for instance, another example on social boundaries, if you tell an autistic person, oh, that lady is on the big side, that's a very social way of saying something. Although some people might frown saying, why are you saying I'm big? But an autistic person can say, but you're fat. And we probably would not take it lightly that, oh, it's very derogatory. But they are very plain and literal, and it's exactly what they see, they say. And we refer that as an impairment on the social front. And that is on the advanced level. There are some other levels of impairment on the social front where they do not key into social ethics that most people key into. An autistic person will not tell you something nice because so that they won't offend you. And that now comes back to the understanding of communication and imagination. They cannot imagine that you have an emotion that could be hurt. So they will just say things literally as the way they see it. Is it a strong trait? I think it's a very good trait. It's a very honest trait. They are being very honest, the way things are to be. But neurotypicals, which is the generality of most of us, we don't see it that way. And so in working with them, you want to now change who they are. You want them to learn social ethics. You want them to learn these things that naturally a neurotypical child will just learn and key into it. An autistic person would not just learn it and key into it, because the impact of the autism is a social impairment, and it just comes out like that. Now, when it comes to imagination, the way I can explain the impairment of imagination is, take for instance, you come into the house, you tell a neurotypical person, let's go for a drive. He knows that for you to go for a drive, you need the key of the car. Might be a very, very vague one. Let's look at another one. If you want to go for a walk, I live in England, and at times it gets very cold. So during the winter, you tell them, let's go for a walk. An autistic person will tell you, okay, yes. He would not wear his shoe. Just as you say, let's go for a walk, he takes it literally and he goes out for a walk. We are going for a walk. Now, if I tell you, let's go for a walk, what I will expect is I don't have to tell you, let's put on a shoe. I expect you to know that, to be
Yeah.
able to have an executive functioning to know that. I also know that the weather is cold out there and you have already, you know the weather is cold. So there's a communication from the environment. I need a coat because it's cold. So let's go for a walk. Wait, let me get my coat. Let me get my shoes. Then we go for a walk. And that's what we call executive functioning, which boils down on the areas of imagination and ability to think outside things. But with an autistic mind, except if he's learned, he probably would just not think about wearing a shoe or wearing a coat, except if he's learned and the routine has been done over time. So whenever you now tell him, let's go for a walk, he just wears the coat, wears the shoe, because he's done that routine over and over again. So he associates, let's go for a walk with shoe and coat. If you do not teach them different weathers, then automatically, even in the summer, they will do the same thing because that's the routine. So we do not want that. So what we do, we have to teach them every bit of things for them to be able to key into things. Now, are all autistic people having such impairment in that way? No. However, most of them boils around those three things. That is what we need to understand. So if, for instance, you're a nurse and you have a colleague who is autistic and he boils around those things, depending on the level of severity, he's a nurse and he's autistic, and you say something and he doesn't do it the way you as a neurotypical or generality of people would do it, you might want to make a fun of him and bully him and say, oh, what kind of a guy is this? Do you understand me? And so you want to understand them. It's a different way of living. It's a different way of perceiving the world around you. It's a different way of doing things. And so you want to understand that way and be able to identify with that person. Now, I said it depends now on the level, and that takes us to psychology says there are three levels, basically. So you have the autism spectrum, and because it's a spectrum, it means that everyone who is autistic is not the same thing. You know, a spectrum is, people could be at the middle, could be at the low functioning end, could be at the high functioning end, could be at the gifted end and things like that. But they are within that spectrum. And so when you look at it, you can find some of them who are highly, highly functional. But at some point in their lives, they need very minimal support to do certain things, which boils down on activities of daily living and things like that. And so I give you an example. Elon Musk is the richest man in the world. He came out some years back and talked about his struggles with Asperger's syndrome. Asperger's syndrome is a syndrome that is on the autism spectrum. That's Elon Musk. He's the richest man in the world. Many of us who are neurotypicals will work for him. And so, and we will relate with him. He has people who work in his companies. He has SpaceX. He has Tesla. He has PayPal. And he manages these companies. So when we say autism, and that's why I said initially, we must not see it as a lack of functionality. Yes, there are different levels, and there are some on the very high functioning levels, but they still have those key impairment areas at a very mild level, which you probably might not notice quickly. Some others will be on the low functioning level, and so they will need support for the rest of their life. So basically, you find it from one end to the other end. And it is the ones who are on that low end, functioning end, which they look as level 3 in psychology. The level 3 and 2 will need considerable support. And it's those ones that people have very negative ideologies about, which has to change. And the best people to change it are nurses, people who work in the care industry. The best people to change it are teachers, people who work with people in the care industry. So teachers, nurses, doctors, paramedics, religious organizations, churches, mosques, parents. These are the people who have contacts with people in the nature of jobs they do. And because you have contact with people, it is going to be a noble task for you to be one to advocate for that vulnerable autistic child out there. Now, when we look at this spectrum, autism doesn't exist in a vacuum. There is what we call co-occurring syndromes. And I would like to let you know that these co-occurring syndromes, they exist in what I would call section 1, section 2, section 3, is just to make you understand these co-occurring syndromes. In the past, I've discussed with people, and a lot of people think when you're autistic, you have mental health. No, autism is not mental health. Autism is a condition that people have and they live with for the rest of their life. So basically, it is important that we know it's not mental health. However, they could have co-occurring syndromes or co-occurring associated syndromes or things that could also cause a comorbidity for them. Take, for instance, for me, I divided these comorbidities into neurological, medical, and mental health. So when we look at neurological, we are looking at things like ADHD. We are looking at things like Rett syndrome. We are looking at things like Down syndrome, cerebral palsy, learning disability, and some others. These are neurological conditions that you could find in an autistic person, and you may not find it. You may also find medical conditions like irritable bowel syndrome, epilepsy, feeding issues, disrupted sleep. Some of them will struggle with issues of sleep, and so they will be struggling with that. And so you will see them, they are not sleeping. And when you don't sleep, you know the impact it will have on your health. And just the same way it will have an impact on your own health, it will have on them. So some of them will have insomnia. Some of them will have feeding issues. They have problems with swallowing. Some of them will have irritable bowel syndromes and things like that. On the mental health front, some of them could have anxiety, could have depression, could have schizophrenia, could have bipolar disorder. Now, these are different sections that could exist in somebody with autism. And the research shows that they are more predisposed to having these things because of the impairment or the impact of autism on them. And so when people see an autistic person who probably has depression on the mental health front, they say, oh, he has a mental illness, and they class the autism as part of the mental illness. And in my experience, I see parents who will probably, they say risperidone or lorazepam will help them to calm down. It might not necessarily mean that it is the autism that is actually making them very erratic. It probably is the co-occurring syndrome. And so the doctor sees that co-occurring syndrome and is trying to give a medication for that. And so when you see parents talk, they say, oh, I used to give my child risperidone when he's very anxious. I give him risperidone and it just calms him down. It's a very good drug. It helps to cure autism. No, it doesn't cure autism. It's only treating certain behavioral expressions, certain
Mm.
challenges that might upset the child, and that's what it's treating. Um, Iosine or Buscopan helps for indigestions and things like that that irritates the belly. An autistic person could be prescribed that, and when he's given that, they said the parent will say, "Oh, he used to have this problem with his tummy, but this doctor gave us this medication, and when we give him, he just cured the autism." Because they are associating that belly and stomach upset and all that with autism. That's not autism in itself. That's a different thing. They are trying to treat that symptom. It's not the autism. I've met a lot of families who use supplements, and they buy a lot of supplements, buy a lot of things, and say it helps to help the child um, with autism, who probably has a lot of challenging behavior that he expresses. And I tell them, do you know what is in that supplement? Basically, what supplements do is probably will calm the child down, make the child dose up the child, and the child is not very active. And at the end of the day, what happens is you are not giving that child an opportunity in life to express themselves. What we must do as nurses is we must start to understand this, what autism is and what it is not. And at the same time, we must begin to understand that these co-occurring syndromes, when they occur, or when there are certain behaviors that stem out of the impact of autism, like challenging behavior, stems out, and we want to address that, then that has to be addressed. Do not give supplements in the name of you are controlling the autism, because you are not. So, and those are some of the experiences we have seen in the field, and we are trying to address, especially in the Nigerian population and in the African population, and trying to address it. That look, autism can be you can work with somebody with autism, and at the same time work with them on a very conservative level through behavioral therapies, routine structures, predictability structures, because generality of autistic people, they love structure, they love routine, they love predictability. And so when you structure their day, you structure
Mm.
their activities, it makes things easier for them. And so those are the things that we need to understand and address specifically when it comes to issues of autism. And like I said, if you are just joining us, you could put your name there so that we can, based on certifications, you could put your name, just put your name and your location. That will help. I will now want to move into learning disability. Like I said, learning disability could be a co-occurring syndrome with autism, but at times you find children who do not have autism or any of those things, but they have learning disability. I want to say at this point that learning disability is different from learning difficulty. So you could have learning difficulty, people with like dyslexia and things like that. That's not what we are discussing about. We are looking at learning disability. And basically, learning disability, it impacts your ability to what? To function with your your activities of daily living.
Sorry, I think
So
we lost him for a moment. Should be network.
can you hear me now? Am I back on? So basically, learning disability is a disability that affects people and their daily functional skills or their activities of daily living, they are unable to attain it or achieve it. And they will mostly need support for basically the rest of their life. However, that's not to say that people with
Mm.
learning disability cannot function. If you teach them, they can function. It depends on the level at which they can function and achieve certain things. With learning disabilities, they also have co-occurring syndromes. Things like somebody can have learning disability and be epileptic at the same time. Somebody can have learning disability and have physical health challenges like respiratory challenges, or sensory impairments, sensory processing disorder. They could have it. So learning disability can be a co-occurring syndrome to autism, and at the same time it can stand alone, but at the same time also have some other co-occurring syndromes that impact it. So you could see somebody with learning disability, but he's not autistic. Autism trait is defined by those three impairments, and there is also a fourth one, which is common, which they call sensory processing disorder, or a sensory processing condition, where you see things like rocking, you see things like steaming, you see things like um, even some self-injurious behaviors could be sensory in nature. There's what we call special awareness in autism, and that special awareness, just like me and you, we could, as I'm sitting here, I know that my head is in place. I know my hand is here, my hand is here, my leg is in place. At times, some people with autism can't sense that. Just imagine you getting up from bed, and you slept on your hand and you can't feel your hand.
You can't feel your head.
Yeah, you can't feel your hand. There's like maybe when the blood
Mm.
flow, you slept on the hand and there's no blood flow, and you sort of numb, and you get up and what you do, you start hitting your hand to get some life back there, and for you to feel that yes, my hand is there, right? It's not withered off. Special awareness. Some of them experience that, and when they experience that, they could hit themselves, they could jam themselves. It could just be to be able to, am I still here? Is my hand still there? Is my head still there?
To
So when they are
reestablish.
doing that, yes, and so when they are doing that, you find out that, oh, they are doing this. Is it damaging? Is it hurting them? Some of them, it could be hurting them. Some of them could walk up to the wall and gently be banging their head on the wall just to feel that. And some of them, because of the pain threshold they might have, the lack of pain that they could feel, they could go very hard on themselves. And in going very hard on themselves, you now find out that they start injuring themselves by hitting the wall. And so what you want to do is you want to probably stop them, give them certain medications to knock them out. And that's what some practices do. However, if you can trace where the problem is coming from, then you could say, okay, let me pad up the room. And so if you pad up the room, basically you are not taking this spatial awareness sensory need from them. You're allowing them to hit their head on the wall, but it's padded, well padded, so they don't damage themselves. But at the same time, you don't take the spatial awareness need from them. And so I had to go back there because of what I was saying about learning disability and sensory impairment. So you could find that circling between people with learning disability or people with autism, and it all correlates together. And so what we, in my own line of experience, we've always learned conservative treatment first, or therapy first, and based on
First.
diagnosis, based on clinical findings, you want to now start looking at the options of medication. But first of all, you need to look at the options of a very conservative therapy management where it is low key. If you can identify the source of the problem, then of the challenging behavior, then you can address it from that end. And so you could find sensory impairments, sensory behaviors with autism, with people with learning disability, and things like that. Then I will look at the blue shorts. The blue shorts is about a boy who, and this is crucial for us as nurses, this young boy loved a blue short. He was going to school, a very young boy, 3-year-old, going to school, and the school had a uniform. But he never loved the shorts of the school uniform because it was really, really very big and oversized. You know the way they sew school uniforms. At times, the short knickers are so oversized that it sort of swallows the child's legs. But this young boy loved his blue shorts, and that is blue shorts. He wanted the blue shorts on all the time. And so, because he wanted that blue shorts on all the time, he wanted to wear it to school. But the parents won't let him wear it because it's against the school rule. The teachers won't accept him coming to school wearing it. And so this boy always threw tantrums every morning before he went to school. Then the question I ask you as nurses, if he wore a blue shirt to school, is he harming anybody? He loves wearing his blue shirt. That is his way of life. That is what he loves. And he's not hurting anybody. He's not harming himself. Why stop him? And so this young little boy was stopped, and he was not benefiting from school. He was not enjoying his nursery classes, and he was being stopped from wearing his blue shorts. What am I trying to say here? What I'm trying to say is basically, as nurses, we must promote difference. We must promote people's differences. As long as those differences do not stand against any law that will impact other people negatively, then we must fight and stand for it. And a country like Nigeria, I think it is pertinent that as nurses, we are supposed to advocate, like Adesu has said, for people with disability. We must advocate for them. We must stand for them. We must push for them so that they can get the support that they need. Many Western countries are doing it. They are supporting the disabled. But in a place like Nigeria and some other African countries, I don't know much about them, I think that is a struggle. And I think it's time, it's long overdue that we begin to start looking towards that end. And which people are better located than nurses to do that. And that's about the blue shorts. I will end up my discussion here with dementia. I won't talk a lot about dementia, but it's an area Ease Neurocare also supports people with. Dementia is not a disease. It's just it's not a specific disease, rather. You have different types, vascular, Alzheimer's, and all that. But the major cause of progressive dementia is Alzheimer's disease. And so what is peculiar about dementia is memory loss, basically. People lose memories of the immediate issues around them. And so if somebody has dementia, he loses memory. We are not talking about forgetting things. We are talking about loss of memory in which it starts destabilizing your functionality. As you grow older, some of us you want to do something, you just forget. Then later you remember. We're not talking about that. We're talking about somebody losing memories, real lifetime memories. They lose it, and they probably might not even recognize their own child. That's the kind of loss we are talking about. And so you find that with dementia, they lose those memories. It affects their functionality. It affects their ability to make decisions. It affects their ability to plan. It affects their ability to, in fact, you could put a food in front of them and they'll tell you have eaten, and they've not eaten for 3 days. It's this kind of memory loss we are talking about. We're not talking about, oh, I forgot. I remembered, I forgot. Oh, what were I coming to do here? That's not what we're talking about. So I don't want you leaving this training session thinking, oh, I used to forget things. So am I having dementia? No. I don't want you to go with that ideology. Looking at real life situations where it affects your functionality, affects your planning skills, affects your decision making, affects your functional skills in every way. So basically, when somebody starts having Alzheimer's disease, it progresses, and as it progresses, it shrinks those aspects of the brain. And when it shrinks those aspects of the brain, what happens is a lot of things starts getting affected. They cannot even participate in many things. You could be giving them personal care and they'll just be looking at you. So it starts progressing. And so for me, in my experience, I used to tell people that dementia, as it relates to Alzheimer, which is the major one, it's a gradual process leading to death, to end of life care, basically. And so when people have that, they become very vulnerable. And people like Adesua talked about how people in society will get somebody who is vulnerable and take money from their ATM and things like that. That's horrible. And so somebody with I know somebody who was living in a place in Nigeria there. The parents had dementia, and then used to be the CEO of Adurak Healthcare, and we wanted to take up a job for them to send carers to their homes. But what we found out was that even family members were financially abusing that person. And so what they were doing was basically meeting the wife, and the wife was just doling out money like that. Nobody in their right senses will do that. So you see, dementia is not just, oh, I forgot to do this. We're talking of things that will impact them. And on the flip side of dementia, as it progresses, there is splatters of memories that come. And so if you walk into a dementia unit or a dementia ward or hospital, what we do is we put memories of their old time in their rooms. So old pictures, we put them there. They will have a memory box. We put it there. And so what happens is once in a while, those memories filter back. In my early days of working with people with dementia years back, I was working in the community, and I walked into, they said, oh, you need to go into this woman's house in the middle of the night. She's bent on going out on the road with her traveling bag. So I got up, went out my car, went for that shift, looked for the woman's house, stepped in. As I opened the door and stepped in, she was with her bag waiting in front of the door. And she said, who are you? I said, I'm the person who is coming to look after you tonight. Tell me what's wrong. And she was like, I need to go out. As nurses, whether it's with autism, learning disability, or dementia, what I want you to know, like I said, you must be a good communicator. You must be a good listener. And so I stood there and I looked at the woman. I said, can you come and sit down? Let's have a cup of tea. And tell me everything about where you are going to. I never challenged where she was going to. Just tell me about where you are going to. We sat down and she started talking. And she said her son was in a town and she was going to meet him in that town. And I said, why do you want to go and meet him there? And she said, they said he had an accident and I have to go and see him. 30 years ago, that woman's son died in a car crash in that same town. And that woman remembered that memory. And she was living out that memory. It was real to her. It was not just, oh, I remember what happened to my son. She was actually living it. And so she got up and she wanted to go that. As far as she was concerned, she was not that 90-year-old woman. She was that 35-year-old woman who her son had a bike accident. And so she was going back to that place. So those are splatters of memories that could come. And when it comes to somebody with dementia, what happens is basically at that point, all they want to do is leave it out. So it's not just a memory loss thing, it's a thing that impacts their daily activities of daily living, and it needs to be addressed. So they need support. There are so many people in Nigeria who have families with dementia, but there is not enough care for them. At East Neurocare, we are trying to fill that gap. And Who do we need to fill those gaps? It's nurses. It's nurses.
Mm, mm,
We need nurses to fill those gaps. And um, it's a beautiful industry if you want to explore the areas of autism, explore the areas of learning disability, explore the areas of dementia, or the neurological issues that affects people's activities of daily living and things like that. Nurses are not trained to just work in hospital wards, giving injections, medications, doing IVs, or doing those kind of therapies. We are also designed to advocate. We are trained to stand up for human rights, to stand up for people's autonomy. And tomorrow we'll be looking at those areas. And I'm hoping we will develop scenarios of these different areas with a patient in your ward, and it puts forward a scenario, and we will look at how those scenarios will be addressed. If you have any question, you can
mm.
place them in the comments and we will pick them up. Thank you. Over to you, Adesua.
Wow. Wow. Thank you so much, Mr. Eri. I just got the proper pronunciation of your name. I'm so sorry.
It's all
Okay.
right.
Thank you so much. So we already have some questions.
Okay.
We already asked like I think 2 questions while you were talking. And the
Yeah.
light on favor said, is it possible they have strong will? I don't know whether he asked when you were talking about autism or when you were talking about dementia, but he said, is it possible they have strong will? I think this should be for people that have autism.
Yes. Yes, I think it's for people with autism. Yes, they do have strong will. Autism, basically, people who are autistic does not mean they don't have emotions or they don't have will of their own or a mind of their own. They do have a mind of their own.
Mm,
Every human being has a mind of their own, just like anybody. And it's because they have a mind of their own, that's why when you disrupt their structure or disrupt their activities as they want it, they probably become very challenging.
mm,
So it's only when they don't have a mind of their own. They do have a mind of their own. Every human being has a mind of their own. Some people might not have been able to find it, but they do have a mind of their own. When it comes to will, if you're asking, are they strong-willed? I think they are strong-willed. When an autistic person sets his mind on something, they do it.
mm,
They don't get distracted. And that's why it's fascinating working with them. When they say, this is what I want
wow.
to do, they go there and do it. Now, if they have ADHD, they might
Okay, attention
jump from
deficit.
that. Yes, they might, if they have ADHD, they might do something and move quickly from it, or they might stay there. In terms of focus, an autistic person has a very great focus.
Hmm.
I have worked with an autistic lad before. He likes playing with, these CD disc drives. This
Yeah.
CD, yeah. He likes playing with them. To us, we might say, how can this be somebody's passion? But that's his passion. And you need to respect it, that is his passion. And all he does is he likes to flap them. What's he achieving from it? It could be a sensory thing, but he likes to
Hmm.
flap them, and he can flap them all day. And he gets satisfaction from it. And he's so focused on that he
Hmm.
achieves it. There is this other
Hmm.
chap in London many years ago. Today he's a man today, and he has an art gallery. Can't remember his name.
Hmm.
This man, they can fly him around they flew him around New York in the air in New York, and he came back sat down in his studio and drew everything he saw from the plane. He drew the city.
Really?
Yes. I will send you the video, and you can share it with stepped up nurses. He drew every dot, every building he saw, he drew it. And that's where their memory is sharp. So in terms of focus,
Wow.
they have it. And what I encourage nurses and teachers and professionals who work with them is, instead of looking at the weaknesses, look at the strength. Find the strength, locate it, and develop it. Then you will see a different personality.
Wow. Oh, this is amazing. It makes me remember the way people that are deaf function. Like, because they cannot hear, other senses
Are very
are
sharp.
sharper. Yes, that
Yes.
if a smell, if you come around there, they can pick your smell. They know the way this person smells. They know the way this person smells. This is just so awesome. This is really awesome. There's another question. It says, can an autistic person work as a nurse or medical professional?
Yes, definitely. An autistic person. In fact, they will make better nurses.
Really?
Yes, why I say they will make better nurses, if they are on the very high functioning level or the above average functional level, then they will make good nurses. Why do I say they will make good nurses? They will make good nurses. One, their memory is very good. And nursing today is not just an art, it's a science. Nursing, you will agree with me that as nurses, you are not a lapdog to a doctor. You are not a puppet to a doctor. You are a professional in your own right, and the doctors need to respect that fact that you're a professional in your own right. And that's why, as nurses, you must be very knowledgeable in your field. Whatever field you are in, you must be very, very knowledgeable. As nurses, you are the check and balance of what the doctors or the pharmacist does. And so, for instance, if a doctor prescribes a drug and you are the one giving it to the patient, if you feel that that drug is not right, you can challenge it. You are not because a doctor wrote it, then you must give it. If you don't challenge it and you give it and something else happens,
You'll
you are
be held
liable.
responsible.
And so, as nurses, you must understand that you're a professional in your own right. Now, let's bring back that into autism. Like I said, an autistic person is much more honest and he doesn't care about your social ethics. So basically, as a nurse, an autistic person who is above average in terms of the impact of autism on him will be able to do every task, because nursing has two aspects. You have the clinical task and you have the aspect where you want to empathize, you want to show compassion, care, you want to show kindness, and you want to mix those two together. And so an autistic person who is above that will be able to run every clinical task. They'll be very methodical in their approach.
Meticulous.
Very meticulous and methodical in the way they approach it. They'll be very structured, and all what the workplace needs to do is the areas where some of them might be lacking, they should be supported. Like you said in your introduction, you said somebody on a wheelchair was brought in and the security man say, come out from your wheelchair and roll. That is clearly a society that does not acknowledge or respect any human being. That is very undignifying. Do you understand me? And so the bank should be held liable for not providing a walkway for a wheelchair. the banks and every organization must be what we call equality and diversity. They must show it in their organizations. How can you build a
So
bank?
there should be another walkway apart from the metallic door that
Yes,
everybody goes through.
there should be another walkway for somebody who is disabled. There should be a disabled toilet. There should be all those things to accommodate. And that's what is happening in a place like Nigeria is they are using the medical model approach to disability. They are supposed to be using a social model approach, which is what is obtainable in many parts of the world. A social model is a model where basically the society, they create things that will enhance ability. So basically, if there was a walkway for him to roll his wheelchair, he wouldn't need your help. He would just roll his wheelchair into the bank. Do you understand? He wouldn't need your help to carry his wheelchair. But when you use a medical model which says it's not bad, medical model is not bad. In the hospital, you are a sick patient, you come in and we say, oh, you are sick, you have this disease, we need to treat you, we will carry you, we will do this for you, we'll do that for you because you can't do it. That's a medical model. It's mostly used in the acute system, maybe in the community hospital, maybe sometimes in the community where you go to people's homes to work. However, we must understand that a social model, there are people who believe in the medical model, people who believe in the social model. I believe in the social model. Is the society that makes people disabled.
True.
A society that creates inclusion and makes sure that there is toilet for an autistic person who has sensory issues. And we make sure that they design the toilet in such a way that when he goes in there, it will help his sensory processing disorder. Then automatically, he can use the toilet. But if you take him to a toilet where there's so much machines blowing here and there, dryers blowing here and there, what happens? It affects his sensory sensitivity. He becomes very upset. It becomes very challenging. You have destabilized him. You have not helped him. So what are we trying to say? There is no job an autistic person can't do. As long as he's able to function, then he can do it. Like I told you, Elon Musk he has Asperger's syndrome, but he's the richest man in the world. He's autistic. He's the richest man in the world. So, which means there are autistic people who can function at that level. So as long as the person can function at that level, why shouldn't they give him a job? They should give him a job. If he needs any support, the organization should provide that support. And that's where the inclusion is.
Thank you so much, sir. God bless you, sir. I think we can take one more question before we wrap it up for today. And then we'll continue tomorrow. And I think Mr. Eri has given us some form of assignment. So if you have a case study to present tomorrow so that we can discuss, it's more like a live session, something to really discuss, then please bring it on, right? Then, okay, there's a question here. Thanks for this wonderful presentation. It's quite informative. Please, what is the trick for, sorry, I'm trying to, okay, what is the trick? Okay, I have learned autistic persons have an hidden talent. Please, what's the trick of helping them discover their talents?
Yes, like we all have talents. Even some of us who are neurotypical, some of us, it takes us years before we realize that, oh, I'm actually gifted in this area of life. It takes some of us years. Some of us just know. Some of us, you probably have graduated. You probably went to read a course.
Some of us, we never know.
And you came out of the university and you say, well, what do I do? This course that I read, I don't really like it, but what do I do? Yes, you could tap into their hidden talents. And for me, I always tell people the best person that will show you what they can do is that individual themselves.
Mm.
But what happens in most of our communities, even in our homes, is, take for instance, a child comes to tell you that I want to join a football club. Daddy, I want to join a football club. Oh, shut up. Football club. Is that why I'm sending you to school? That's what in our generation, I don't know whether Nigerian parents now do it, but when I was growing up, you dare say you want to play football. I send you to school to be an engineer or to be a lawyer. What we have done is basically shut that child down.
Mm.
There's a reason why the child says, I want to join a club to play football.
Mm.
And so I tell people, it's just the same thing. Autistic people or an autistic person who comes to you and says, I want to play piano, take hold of that opportunity and give him that
Mm.
chance. I know a lot of autistic people who play piano. In fact, I have worked with a young man, and when he starts playing piano, in fact, you will just be relaxed. And I know that same man is fascinated with televisions. And so he goes to the market and buys televisions, old TVs, and he fixes them to work.
Hmm?
You go and buy scrap and you sit down and fix them to work. So when you see that, you want to know that this child might be good in electricals. He loves electricals. And so you want him to explore that area. I've also worked with a child. In fact, this is a man. And when I started working with him, he likes riding bicycle. Then I decided I will ride bicycle with you.
Hmm.
And so we kept riding bicycles for miles. In the countryside of where I was working, it was in a countryside, and we were riding bicycles. And until later, I now started developing a proposal for them to think about giving him an opportunity for Paralympics. And so basically, I think the best answer to your question is you need that person to express themselves, allow them to express themselves, and within those expressions, you will be able to catch something that they can develop into something useful. Then you work on that. Any other question on this one? Hello? I think Adesua is off. I don't know. So I don't know. We'll just, is Adesua still there? Okay. We will, if there's any other question, Adesua, are you there? I think we've lost her.
Hello? Yes, sir.
Hello, are you there?
I'm here.
Okay. Any other question?
Yes, I think those are all the questions we have. I
Okay.
think there was a private question sent that people that have dementia, are they suicidal, or people that have dementia, are they usually
Yeah.
depressed or suicidal?
Yes, of course. Some of them some of them could have comorbidities that is relating to depression. And when the doctors identify that, or when you as a nurse caring for them identify that, then you could sort of flag it up, and they will give them medications for that. It doesn't mean because they have dementia. We must understand that dementia has to do with the brain, and we must understand that mental health has to do with the mind. And so that's why we don't mix them together. I know when they say dementia, a lot of
Mental
people,
health, mind.
yes, because with dementia you could see things like depression, anxiety, and things like that. It also occurs there as well, and so those things will be treated um, as um, as they need to be treated. I can see a question here. It says, "Is there anything like autistic age?" I don't know what you mean, Nos Ugu, by autistic age, but if my understanding gets me right, maybe you are looking at the age of diagnosis. Yes, when a child is born, most of the time, by the age of 3, there is you could easily spot the symptoms if they have it. And so most doctors want to start diagnosis at the age of 3. However, some people do not show the symptoms of autism up until age of 8 or 9, 7, 8, 9. And that delay it mostly occurs in female children. That delay mostly occurs in female children. So you see the child will be living a normal neurotypical life, and suddenly at the age of 9 or 10 or 8, you just seeing some symptoms. So when you start seeing that, you now want to take them for diagnosis, and you want the doctor to be able to say, is it a level 1, a very a level 1, which is very mild condition, which might need very minimal support, or is a level 2 or a level 3, which will need a level 2 will need considerable support. A level 3 will need very, very, very intense support. So if I don't know if I've answered your question, but there's nothing like autism affects only people of this age. It's something that comes from birth. Dementia also, on the other hand, is not peculiar to old people. There are some young people who have dementia as well. But the one that is caused by Alzheimer's disease is the one that you find affecting mostly older people. But you could see people in their 30s who have some young onset of dementia. It does happen. Yes. Somebody's
Okay.
asking if we can get the recording for today because the network wasn't stable. I think Adesua is recording it. Adesua, I think we can get a record of it, then can't we?
Yes.
Yes.
Yes, we can. I think we can wrap it up now for the day. Thank you
All
much,
right.
sir. God bless you.
Yeah,
So,
thank you.
I've learned a lot today, and I believe every single person that logged on today has learned a lot. Please, I want us to do something. If you belong to any of the WhatsApp groups that informed about this program, the Stepped Up Nurse Academy, on Telegram, on WhatsApp, and the Air Force College of Nursing, please do well to also let them know that we'll continue tomorrow. We want everyone to join tomorrow. We had the maximum of 35 people on the call today. We want everyone to join tomorrow. Please do well to share with them what you have learned. I have screenshots from here, right? But please share with them what you have learned from today and encourage them to join us. It's still the same link that we used to join tomorrow, please, and it's still the same time, right? Same time, or maybe we
Yes.
should start by 6 tomorrow. I don't know if it would be convenient. Should we start by 6 tomorrow? I don't know, but
It's
all the
fine with
same,
me.
I would say thank you. Okay. So if we are going to be adjusting the time, I will let us know before it's time tomorrow. Thank you so much, everyone. Thank you so much, sir, for this very impactful session. In fact, I the network messed up for a while, and I was I was frantic. I was seriously frantic during that period. I had to switch off my phone and switch it on before I could come back here. And throughout that session, throughout that period, Miss Aisha was speaking. It was so painful that I couldn't hear her. So I guess I have to sit down with the recording myself. Thank you so much, sir. Thank you.
Yeah.
So we are going to have our closing
Yeah.
prayer. I'm going to pray with us now
Yeah.
for 30
Before
seconds.
we
Let's
close,
pray.
hello,
Okay.
Adesua, before we close, I just want everybody to know that tomorrow we have another parent who is coming to share with us our own
Okay.
experiences. I don't know. I would employ everybody to come on time so that they can listen to her as well. She's one of the parents I've had
That would be
contacts
awesome.
with for many years now, and all right,
Mm.
yeah, that's it.
Yeah, thank you so much, sir. We'll be really excited to have her, and this is more. In fact, there's something like experiential knowledge actually being shared with everyone. Thank you so much for bringing them on board. Okay, let's
Yeah,
pray.
you're welcome.
Father, we thank you for this session. We thank you for the opportunity to learn. We pray that when we have the opportunity to be of help to people with special needs, we will not withdraw care and we will not be found ignorant in that time, in Jesus' name. Lord, we
Mm.
pray that you will use us continually as nurses, as health professionals, to be channels of blessing to others in Jesus' name. Amen. Thank you so much, everyone, for
Thank you,
joining
everyone.
us.
Thank you for joining.
Thank you. Please do
Okay.
well to join us again tomorrow to be an impactful session. Thank you so much. So I'm ending the call now. We can
Yeah.
all log out. Thank you.
Thank you.